pathology pots. You'll find this presentation useful. It's a series of pathology pots collected by WorldOrtho. Gives an overview of some common orthopedic conditions. Osteoarthritis. Read the legends carefully. It gives some of the common causes. Further causes of osteoarthritis. Read the legends carefully and correlate with the deformities of the femoral head. Further cause of osteoarthritis. Further cause of osteoarthritis, and this one has led to a knee replacement. It includes the definition. Menisci, showing them presented, how to differentiate the lateral from the medial. Left meniscus shown, and you can determine the features to determine the lateral from the medial. See, the lateral is smaller, virtually inside the medial. AVN, this is quite a common condition still. You can see the causes here of steroids. See the changes in the femoral head? Onchronosis is an unusual one. See the black pigmentation of the cartilage? Quite unusual. High-grade osteosarcoma, upper tibia. Read the legends carefully. Pathology pot, imaging and histology here. Chondrosarcoma, proximal humerus, unusual, but you do see cases in a large population. Pathology pot, X-ray, imaging, operation shown. Another case of chondrosarcoma, complicated by pathological fracture. Giant cell tumor, lower femur, pathological fracture. Look, it's blown out. Ewing sarcoma, see it in children, younger people. See the histology, X-rays, and the operation done. Read carefully. Fibroma, upper fibula, here it is in the pathology pot. Unusual tumour. Lotoma, fatty tumour, quite common. Fibrochondrohamartoma, unusual tumour, here it is upper fibula in the pathology pot. Tumours, describing tumours, primary, secondary. Read this carefully, you'll find it useful. Sequestrum, it's dead bone related osteomyelitis. Read it carefully. Infection, quite serious in orthopedics, devastating, hard to get rid of. Paget's disease, quite common in Australian, New Zealand, British and American population. Bone overgrows, but is actually quite fragile, gets secondary OA. Here's a hip replacement resulting from it. Further information about Paget's. Gouty olecranon bursitis, look at it, full of gout crystals like a sludge. Further information about gout. Loose bodies in the knee. Here are a couple of loose bodies collected, cause locking of the knee. Betz neuroma, it's a neuroma of the nerves between the metatarsal heads of the foot. It can be quite painful, and here's one excised. Morton's metatarsalgia related to it. Freiberg's disease, it's avascular necrosis, second metatarsal head. Read it carefully, don't miss it when the case turns up. It can be in young teenagers as well. Dupuytren's common in UK, America, Australia, New Zealand. Digit had to be excised, so deformed. Further information about Dupuytren's, of course common in France where it's first described. A lumbar disc rupture causing disease, pressure on the nerve. Here's the disc excised, or the ruptured disc excised, a fragment. Further information, lumbar disc rupture. Rattler. Let's read the legends carefully. It's an old operation, don't do this now. Take out the posterior arch of the vertebral body because it's disconnected by pars defects. Further information about it. Here's a rigid clubfoot with the whole talus removed. Bit unusual to do this operation now. Clubfoot. Some information about it for you. Hope you found this